What if I told you that brain surgery in India started not 200 but over 2600 years ago? In a time when most of the world believed illness was caused by evil spirits, one man was opening skulls to save lives. His name? Sushruta, the father of surgery. But did ancient Indians really perform brain surgery? Let's find out. Today we explore the science, the mystery, and the legacy of ancient Indian neurosurgery. Sushruta lived around 600 BCE in Kashi, now Varanasi, one of the world's oldest continuously inhabited cities. His textbook, Sushruta Samhita, wasn't just a guide to healing, it was a surgical encyclopedia. He described over 300 surgeries, 121 surgical tools, 1100 diseases and treatments, and also introduced the idea of learning surgery by practice using models like vegetables, fruits, and animal tissue before touching a human patient. Let's get into the brain. Sushruta described a technique called Kapal Bhed, literally opening of the skull. In today's terms, that's craniotomy or trepanation. It was used to treat skull fractures, head trauma from warfare, neurological symptoms like seizures, excess pressure inside the skull. He even used herbal anesthetics, including dhatura, cannabis, and wine, to sedate the patient before cutting. His tools? Metal scalpels, forceps, needles, and bone saws. His sutures were made of natural materials like silk threads and even ant jaws in some tradition. It sounds primitive, but it worked. Still skeptical? In Mehergarh, part of modern day Pakistan, archaeologists found skulls with clean cut holes in the cranium over 4,000 years old. The surprising part? Some showed signs of bone regeneration, proof that the patients survived the operation. Even in Lothal and Harappa, skull injuries appear to have been treated surgically. These findings suggest India was practicing cranial intervention well before the Greeks or the Romans. Now here's the global perspective. In ancient Egypt, trepanation was rare and mostly symbolic. In Peru, the Incas used skull surgeries but lacked documentation. Greece's Hippocrates came 2 centuries after Sushruta and described far fewer techniques. Only India combined surgery with systematized medical training and documented case studies. That's what sets Sushruta apart, not just that he did it, but how thoroughly he wrote it down. Of course, Sushruta didn't understand the brain like we do today. He didn't have MRIs or understand neurons, but his observations were surprisingly accurate. He knew that head trauma could cause mental illness or seizures. He treated hydrocephalus like symptoms using cranial decompression. He advised post operative care with antiseptic herbs and bandaging. Modern neurosurgeons agree while ancient techniques were crude, their intent and anatomical understanding were remarkable. Imagine this, using bronze tools and herbs, ancient surgeons managed procedures that required sterile environments and decades of training today. Sushruta's name lives on, not just in Ayurveda but in modern medicine. The Sushruta Institute of Plastic Surgery in Varanasi honors him. AIMS and other institutions have revisited the Sushruta Samhita to draw connection with modern techniques. In 2022, UNESCO listed Ayurveda's contribution to medicine as intangible cultural heritage. Even WHO recognizes traditional Indian systems as valuable for preventive and alternative medicine. Could it be that ancient India was not behind modern science but far ahead of its time? Let's ask a bold question. Could Sushruta's brain surgery work in 2025? Technically, no. Modern neurosurgery requires microscopic tools, real-time imaging, controlled environments. But if we are talking about concepts, cranial access, pain control, post-operation care, then yes, Sushruta laid the foundation. And with advancements like robot assisted surgery and AI diagnostics, maybe blending ancient wisdom with modern tech isn't that far fetched. The real lesson? Science isn't always about machines. It's about curiosity, documentation, and bold experimentation. Sushruta had no electricity, no labs, but he had a scientific spirit. His book Sushruta Samhita documents over 300 types of surgery, including cataract removal, plastic surgery, bone setting, and many more. He taught us that learning must be hands on, healing needs compassion, and medicine must evolve with time. In a world obsessed with innovation, maybe we need to rediscover our roots. So, did ancient Indians perform brain surgery? The answer, not in the modern sense, but yes, in principle and practice. Sushruta's work stands as a beacon of India's scientific legacy, one we must never forget. Tell us in the comments, do you think ancient Indian science is underrated? And would you trust a Sushruta style operation today if you had to? If this fascinated you, like the video, share it with your friends, and subscribe for more ancient Indian genius revealed. Until next time, keep questioning, keep exploring.